Diagnosis of borderline personality disorder, BPD, how BPD is diagnosed, tests, interviews, observation. Diagnosing borderline personality disorder, BPD, is a nuanced and multi-step process that involves careful clinical evaluation. Because BPD shares overlapping symptoms with other mental health conditions, a thorough and accurate diagnosis requires the expertise of a trained mental health professional. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore the process through which BPD is diagnosed, including the use of clinical interviews, structured assessments, and observational methods. The role of the mental health professional. The diagnosis of BPD generally begins with a mental health professional, typically a psychiatrist, psychologist, or clinical social worker, who conducts a detailed assessment of the individual's symptoms, history, and behavior. This assessment is an essential part of the diagnostic process, as it helps the clinician understand the full scope of the person's emotional and behavioral challenges. An accurate diagnosis is critical for effective treatment, as BPD shares some symptoms with other conditions, such as depression, anxiety disorders, and other personality disorders. Thus, a comprehensive evaluation is essential to differentiate BPD from these other conditions and to develop a tailored treatment plan. Clinical interviews. Clinical interviews are one of the most important tools for diagnosing BPD. These interviews allow the clinician to gather detailed information about the individual's life history, relationships, emotions, behaviors, and any symptoms they have experienced over time. 1. Structured clinical interviews. A structured clinical interview follows a set of predetermined questions based on the diagnostic criteria for BPD outlined in the Diagnostic and Statistical Manual of Mental Disorders, 5th edition, DSM-5. The clinician will ask questions about the individual's emotional stability, relationship history, self-image, and impulsivity to assess the symptoms of BPD. The diagnostic interview for borderlines, DIB, is an example of a structured interview used to assess BPD symptoms based on DSM criteria. These structured interviews help ensure that the clinician asks the right questions to capture the full range of symptoms and experiences related to BPD. They also help in differentiating BPD from other mental health conditions with overlapping symptoms. 2. Unstructured clinical interviews. In addition to structured interviews, clinicians may conduct unstructured clinical interviews that allow for a more flexible, open-ended conversation. In these interviews, the clinician will explore the individual's emotional experiences, past and present relationships, and significant life events. This open-ended approach provides the opportunity for the individual to share their story, giving the clinician additional insight into their emotional and relational difficulties. The unstructured interview helps clinicians explore a broader range of factors that might not be captured by rigid questioning, such as childhood trauma, family dynamics, and the individual's subjective experiences. Self-report questionnaires. To supplement the clinical interview, clinicians often use self-report questionnaires or screening tools that help assess the severity of symptoms and provide a structured way for the individual to reflect on their behaviors and emotions. Some common self-report questionnaires include 1. The McLean Screening Instrument for Borderline Personality Disorder, MSI-BPD. This tool is a brief self-report questionnaire designed to screen for the presence of BPD symptoms based on DSM-5 criteria. It is commonly used as a preliminary assessment to identify individuals who may have BPD and require further evaluation. 2. The Borderline Evaluation of Severity Over Time, BEST. The BEST is a tool used to measure the severity of BPD symptoms over time. It helps clinicians assess the intensity of symptoms and track changes throughout the course of treatment. 3. The Zanarini Rating Scale for Borderline Personality Disorder, ZAN-BPD. This scale is an in-depth, clinician-administered assessment tool that evaluates a wide range of BPD symptoms and the impact they have on an individual's life. It is often used in research settings to assess the severity of BPD over time. While these self-report measures provide valuable information, they are just one component of the overall diagnostic process. They are most effective when combined with clinical interviews and other diagnostic tools. Observational methods. Observation is another key component in diagnosing BPD, especially in more complex cases where symptoms may be difficult to assess. During the assessment process, a clinician will observe the individual's behavior, emotional responses, and interpersonal interactions. Observing how a person reacts to stress or interpersonal conflict can provide valuable insight into the emotional dysregulation and relational difficulties that characterize BPD. For example, a clinician may observe how the individual handles frustration, how they express anger, or how they react to perceived rejection. Individuals with BPD often exhibit intense emotional responses that may be disproportionate to the situation, and observing these reactions can help the clinician identify key symptoms. Additionally, family members or close friends may be interviewed, with the individual's consent, to provide more context about their relational patterns and behaviors. These external perspectives can be particularly useful when the individual may not fully recognize or articulate the depth of their emotional instability or impulsive actions. The role of family and collateral information. While the individual's self-report and clinical interview are essential to the diagnostic process, obtaining collateral information from family members, close friends, or significant others can provide a fuller picture of the person's symptoms and behaviors. Since BPD is characterized by unstable relationships and intense emotional reactions, understanding how the individual interacts with others can provide important insights into their interpersonal difficulties. Clinicians may ask family members or close friends about the individual's emotional outbursts, patterns of impulsivity, and reactions to relationship stress. This information helps to confirm the presence of BPD symptoms and adds context to the diagnostic process. However, it's important for the clinician to consider potential biases in collateral reports, as family members may have their own emotional responses to the individual's behaviors. Ruling out other conditions. Because BPD shares symptoms with several other mental health conditions, the clinician must rule out other possible causes of the individual's symptoms. For example, mood disorders, such as depression or bipolar disorder, may share some symptoms with BPD, particularly emotional instability and impulsivity. Post-traumatic stress disorder, PTSD, can overlap with BPD due to emotional reactivity and interpersonal difficulties, especially when trauma has played a role in the development of the disorder. Other personality disorders, such as narcissistic personality disorder, NPD, or antisocial personality disorder, ASPD, may also present with overlapping traits, such as impulsivity or relationship instability. Differentiating BPD from other conditions is crucial because treatment strategies can vary greatly depending on the diagnosis. For example, individuals with mood disorders may benefit from mood stabilization treatments, while those with BPD require therapies focused on emotional regulation and interpersonal relationships. The importance of a comprehensive evaluation. A comprehensive evaluation that includes clinical interviews, self-report questionnaires, and observational methods is vital for an accurate diagnosis of BPD. This thorough approach helps ensure that the diagnosis is correct, and that other potential causes of the symptoms are ruled out. It is also important for the clinician to understand the individual's life history, as the symptoms of BPD often emerge in early adulthood and may be deeply influenced by childhood trauma, relationship patterns, and environmental factors. A complete assessment allows the clinician to understand the complexities of the individual's emotional experiences and to develop an appropriate treatment plan. Conclusion. Diagnosing borderline personality disorder, BPD, involves a careful and comprehensive assessment process, combining clinical interviews, self-report tools, observational methods, and collateral information. The goal is to gather a full picture of the individual's symptoms and behaviors to ensure an accurate diagnosis and to distinguish BPD from other conditions that may share similar symptoms. An accurate diagnosis is the first step in developing an effective treatment plan. In future episodes, we will explore the different treatment approaches for BPD, including dialectical behavior therapy, DBT, and cognitive behavioral therapy, CBT, and how individuals with BPD can benefit from a tailored, empathetic treatment approach. Stay tuned as we continue our exploration of borderline personality disorder.